Hi friends, I am Dr. Pratap Singh Rathore. In this video, we'll continue with general toxicology. In last video, we discussed about classification, and now we'll continue from that. Coming to routes of administration of poisons, in order of rapidity of actions, it can be inhaled route in the form of gaseous or vaporous form, or in like volatile substances like benzene, toluene can be inhaled. Then some gases like carbon monoxide, hydrogen sulfide can be administered as a gaseous form. Next is in injection form into blood vessels or in for intramuscular form in intramuscular or subcutaneous or intradermal injections. Then application on the wounds or serous surfaces or any bronchotracheal mucosal membrane can be administered. Then it can be introduced to stomach in form of seeds or any poisons liquid, any form it can be administered in stomach, which is commonest. Then it can be introduced in many natural orifices like rectum, vagina, urethra, etc. Or it can be applied on the unbroken skin. Mainly like any poisons which are easily absorbed includes organophosphates, nicotine, phenol, endrin, vitamin D, K, testosterone, hormones. These are all poisons can easily absorb from the unbroken skin. Next, coming to fate of poisons in the body. So once the poison enters the body, how it is eliminated. The greater part of poison is thrown as a result of vomiting and purging. Once the person consumes from the stomach, because of its irritant effect, person may vomit it up. Any part of poison which is present in the stomach, it deposited into the less soluble form in the liver, which either partially metabolizes it or completely destroys it based on type of poison. Then in the stomach, it may be absorbed in the blood, general circulation, act as a body as a whole, or it may be affect on a particular organ subject to that part, like strychnine, which acts mainly in the spinal cord. Then some of the poisons may be destroyed or made harmless by the kidneys and muscles. Some inorganic poisons like arsenic, antimony are retained in certain tissues for longer durations like nails, hairs, and bones. Certain poisons like chloroform, phosphorus, nitrates, and acetic acid disappear by evaporation or oxidized or destroyed in the body. Like sometimes some poisons which delay putrefaction of the body, like heavy metals, carbonic acid, and chloride. Some poisons hastens the putrefaction; they increase the putrefaction process, like alcoholism, hydrogen sulfide. Some poisons resist putrefaction, like corrosives, acids, barbiturates, organophosphates, cyanide, etc. Some poisons are destroyed by putrefaction, and that means when the putrefaction starts, if the person has died because of the poison, it will be completely eliminated. Some poisons, after entering circulation, they again secreted into stomach, like some acidic poisons like salicylic acid, barbital, phenobicide. Some basic poisons like theophylline, antiphylline, aminophylline, narcotics, cocaine, amphetamines, all are secreted into the stomach. Then route of elimination of poisons. So absorb poisons from the liver, kidney, if it is not destroyed once it is circulation, they are mainly secreted in the kidneys or to some extent by the skin. Other routes includes they are secreted in bile, milk, saliva, mucous membrane, or serous secretions. Some unabsorbed poisons is secreted in the form of in the vomit or in the feces. Actions of poisons. Poisons can act on a locally or remote or in both ways. Locally, some poisons act locally when they taken, like chemically destructive by corrosives, or causing congestion inflammation by irritants, or may cause effect on the motor senses nerves, like tingling of skin and tongue by aconite, dilation of pupils by belladonna tuberous. So these are poisons which are local or act on this particular organs. Remote, when the poison's action produce shock because of their reflexly, like by pain, or like corrosives, when person consumes corrosive because of extreme pain, the patient goes in shock. Or systemic poisoning through blood, like nexomica acting on the spinal cord. Or combined action where drugs like carbonic acid, oxalic acid, phosphorus, they act both on the locally as well as remote actions. Coming to factors influencing the action of poisons. So certain factors which may increase the action of poisons or decrease the actions of poisons. First is the quantity. So higher the dose of poisons, the action will be more and it will be fatal as taken more. A moderate dose causes acute poisoning. A low dose may cause subacute effects, subclinical effects, and cause chronic poisoning in longer duration. And form of poison. So physical state depends on the physical state. As I mentioned, gaseous or volatile substances are quickly absorbed. Liquid poisons are more rapid than the solid poisons. Powder form of act more quickly than the coarse act substances. Some poisons like vegetable seeds may pass through the intestine ineffective when taken as a whole because of impermeable pericarp. But when the same seeds are crushed or chewed, they become fatal. Then chemical composition of the poisons. Whether chemically which are pure like arsenic and mercury are not poisonous, but when they are present in their salt form or like arsenic oxide or mercury chloride, they becomes deadly poisons. Barium sulfide is deadly toxic, but barium sulfate is non-toxic. So composition of chemical, the same poison will also depend on their toxicity. Mechanical composition combinations. Action of poison is altered when it combines with the mechanical with inert substances. So, like corrosives, if it is diluted enough, it will not be effective. So, if the same poison is mixed with other poisons, they may not act as intended. Mode of administration. So, absorption rate is different for different routes. So, gases is the fastest route, then in the IV, IM, subcutaneous, intradermal, then open wound, then serous surfaces, then ingestion, then any natural surfaces, then unbroken skin. So unbroken skin is the say where the absorption is the slowest, and gaseous form is the where the absorption is the fastest. Then the condition of the patient. Age is the most where the extremes of the age, that is children's and the old age, are the most where even the small doses of poison may become fatal. Then state of the body health. A well-built person with good health can tolerate the action poison better than the weak persons. Then in presence of disease. In certain disease conditions, such as some drugs are tolerated exceptionally well, like sedatives and tranquilizers are tolerated in very high doses by maniac and delirium patients compared to others. Then intoxication or any poisoning states. When in certain poisoning cases, some drugs are well tolerated, like in case of strychnine poisoning, barbiturates and sedatives are better tolerated, whereas in cases of barbiturates poisoning, any sedative or tranquilizers will increase its action. Sleep. Due to slow metabolic process, the depression of the body functions during sleep causes absorption, decrease the absorption of certain poisons, but depressant drugs such may cause more harm during the sleep. Exercise. Action of alcohol and on CNS is slow during exercise, but because of more drawing to the muscles during exercise. Cumulative action of poisons. Preparation of cumulative poisons which are not readily excreted from the body and are retained in the different organs of the body, like lead, may cause longer action on the longer duration. Means they get deposited slowly and cause long-term effect when taken in the low doses. But when such poisons enter over a long period of time, they cause harm when their concentration in different tissue reaches very high level due to cumulative property. Tolerance. Sometimes certain poisons cause develop tolerance in certain individuals, and sometimes in other individuals they may cause immediate effect. Idiosyncrasy. So it depends on the person to person. Some persons may react adversely to a particular drug which is beneficial to some patient, but in some patient it becomes fatal, and it may act like a same drug will act become a poison. And coming to types of poisoning, so types of poisoning mainly depends on the how the poison acts. Like acute poisoning, it causes by excessive single dose or several smaller doses of poison taken over a short interval time. Within short interval time, the person dies because of acute poisoning. Chronic poisoning is caused by smaller doses for a period of time, resulting in gradual worsening, like arsenic, antimony, phosphorus, smoking. When taken small doses, they cause longer, they get deposited in the body and causes long-term effect. Then subacute poisoning shows features of both acute and chronic poisoning. Then fulminant poisoning is produced when a massive dose of poison is taken. In this poisoning, death occurs rapidly without any symptoms. And if it is in a form where even if it is taken in such a large dose that immediately after taking the poison, the person dies.